Diogenes syndrome is one of those disorders we don't talk about enough. It is not just about clutter or being messy. It is a serious behavioral disorder where a person lives in extreme self-neglect, hoarding items, refusing help, and often isolating from others completely. It is named after Diogenes, an ancient Greek philosopher who rejected material comfort. But in reality, this disorder has nothing to do with philosophy. It is a psychological collapse of self-care, connection, and safety. People living with Diogenes syndrome might stop cleaning their homes, collecting trash or random objects until their living conditions become unsafe. They might refuse medical treatment, avoid bathing, and push others away, even those who try to help. The home often becomes a mirror of the mind, chaotic, suffocating, and overwhelmed. This syndrome is most common in older adults, especially those living alone, and is often linked to underlying mental health conditions like dementia, depression, schizophrenia, or obsessive compulsive disorder. But it can also appear in people who have experienced trauma or long term emotional neglect. Treatment is complex and requires patience, empathy, and a team approach. It often involves medical care, psychiatric intervention, social work, and sometimes environmental cleanup for safety. But the first step is always connection, earning trust, not judgment, because behind every case of extreme neglect is usually a story of pain, loss, and loneliness that went unnoticed for too long. There is hope. With gentle, consistent support, therapy, and medical help, many people regain their sense of dignity and begin to rebuild their lives. If you ever meet someone living in conditions that shock you, pause before judging. Ask yourself what they have survived. Diogenes syndrome reminds us that neglect is often a symptom, not a choice, and compassion can be the first step towards recovery.